Hello and welcome to Creating a Family, talk about adoption, foster care, and kinship care. This podcast is a production of creatingafamily.org, and my name is Tracy Whitney. I am your new host to both of the Creating a Family podcasts, and I'm delighted to be here today. We're going to be talking about a topic that I don't know enough about, both as a parent, as an educator, and I'm excited to speak with Dr. Krishna White. She is an attending physician in the Craig Dulcimer Division of Adolescent Medicine at the Children's Hospital of Philadelphia. She's a professor of pediatrics in the Perelman School of Medicine at the University of Pennsylvania. She's board certified in pediatrics, adolescent medicine, and addiction medicine. And in 2019, she joined the Division of Adolescent Medicine at CHOP in order to start a substance use clinic. She's currently the medical director of Adolescent Specialized Treatment and Recovery Team and the outpatient medical director for the division. Wow, you've got a full plate. After many years of clinical practice and advocacy, she became board certified in addiction medicine in 2020. She is also the proud wife, mother of a teen daughter, and stepmother of 3 young adults. So she's got lots of life experience, plus medical experience and education and training. And so we're thrilled to have you here today. Welcome, Dr. White.
Thank you so much for having me. I'm very excited to talk to Creating Family today.
Thank you. We are going to just kind of couch this in terms of an intro that will help families kind of get where we're going. So many of us in the adoptive, foster, and kinship community, kinship meaning families who are raising family members, are raising kids who've been exposed to trauma, who've been exposed to neglect, abuse, prenatal substance exposure from when their birth mother was pregnant. And many of these kids, therefore, process the world differently than, say, a typical child who's not had those experiences. These factors can increase their vulnerability to risky behaviors such as substance abuse. So, Dr. White, we would love for you to guide us today through a conversation that will educate parents and caregivers about marijuana and vaping and how they show up in the lives of our kids, what we should be watching for, and most importantly, how we as parents and caregivers can support and protect and guide our kids through the challenges that they will face in adolescence. So let's get started kind of with a baseline definition or working definition of why kids in our community of adoption, foster care, kinship, or relative caregiving who've experienced these hard life stories before coming to our homes, why are they maybe more at greater risk for turning to substances like marijuana or vaping?
So, that's a very good question, and it's a complicated question, and it's a mixture of biology and social factors. So one, we know that a lot of kids that are in kinship and foster care are there because their parent has, one or more parents has a substance use problem. And so that means that they've had maybe early exposure to substances. It also means that they might be genetically more predisposed to substance use disorder because we know there are genes that put you at higher risk of addiction. It's not just a social failing or a problem with will. We know that it's a neurochemical chronic relapsing brain illness that starts in adolescence.
So how are kids using these substances today? Specifically, how are kids accessing or using, we'll start with marijuana. How are they getting a hold of it and how are they consuming it?
So it's changed from when a lot of us were younger. Now, a lot of times people are vaping it. In addition to smoking, they're also using edibles. So it's available in multiple different forms. And some of those forms don't have the smells that you remember growing up in childhood with it. They don't have an odor. If you have an edible, it can look like just regular food and candy. And so some kids are using, they don't know that the products have these THC or cannabis in it. And then some people, it decreases the barrier to use it if you can't get caught from a smell.
So you mentioned that they may not always be aware that they're consuming something with THC in it. Are they aware of the differences in potency from, say, when we were adolescents and adolescents today? Are they aware of that difference in potency, and how different is marijuana today?
So, I'm a 90s kid. And so I always tell my patients, this is not your 90s weed. Um,
Right,
it's
right.
not from the earth. All the things that we heard growing up, a lot of this is there are chemicals. Yeah, it's
Mm-hmm.
not from the earth. It's concentrated. It's a lot more potent.
Mm-hmm.
Marijuana in the 60s was like had 3% THC. In the 90s, 6%. Some of these products have 50, 60, 90% THC content. So it's a
Yeah.
lot more potent than the products that were available decades ago.
So it's more accessible in that it's in a lot more vehicles of delivery, and now it's more potent to boot.
Exactly.
Okay. I'm sorry to interrupt this intriguing conversation. I hope you feel like you're learning as much as I'm learning as we're listening to Dr. White. I wanted to let you know about a learning opportunity that comes from our library of 15 free courses sponsored by the Jockey Being Family Foundation. You can take one course, you can take two courses, or you can take all 15 if you want. They're free, all online. And if you go to bit.ly/JBF support, that's bit.ly/JBF support, you can see the full library of courses that we've put together that will strengthen your family and help you with things like talking to your kids about weed and how to navigate those conversations. Thanks so much and have a great day. So, what are some of the short-term effects of marijuana use in adolescents that you can help us understand?
Sure, that has changed as well. And so I'm so glad that you're asking me the question so parents can be aware. Again, we may remember the munchies and being hungry and red
Right.
eyes, right? Those are the things that we remember. Right now,
Mm-hmm.
we're actually seeing appetites going down and weight loss.
Mm.
We may remember it was used to treat cancer and AIDS patients because of vomiting. Now we're seeing the potent products are causing vomiting so bad that people are admitted to the hospital because they can't stop it and the typical vomiting
Mm.
medications don't work. So those are some of the short-term things that we're seeing: weight loss, vomiting, belly pain. We've also seen increase admissions for psychosis or altered mental status because we know that, again, these high potency products and marijuana in general, even at lower potencies, can make you more likely to have a psychotic episode, particularly if you have a genetic predisposition to do so.
So, psychotic episode, can you unpack that just a little bit for us?
Sure, where people are just acting strange. So, they may be aggressive, they may be confused, anxious, irritable. And so any of those change in behavior and change,
Mm-hmm.
quiet, withdrawn, depressed, crying,
Okay.
any of those things that we're seeing could be a sign of marijuana or cannabis use.
So those are all the short-term impacts that we might see in our homes or in our interactions with kids in our care. What are then some of the long-term impacts that you're seeing from marijuana use with its easier accessibility and its higher potency?
So a lot of this we're still learning. And so we know that there's more likely to have psychotic disorders like schizophrenia in some people, not all, that use marijuana. And the question is going to be, since we're seeing more of the psychosis at younger age, are there going to have more people that are going to have those long-term, more permanent psychotic disorder diagnosis
Mm-hmm.
like schizophrenia? We also know with marijuana addiction, I think kids, when they're using, they might be using to cope with something, using to get high, deal with stress. But most people aren't trying to use a substance to become addicted to it and have to use it in order to function. And so we know the earlier that teens use a product, any product, the more likely they are to develop addiction. And so we can expect to have addiction rates that would be another long-term outcome. But again, this generation, unfortunately, is going to tell us what happens when you have long-term exposure to high THC products, because that's not something that's happened in prior generations.
So you mentioned the risk for addiction. I'm assuming then that maybe some of the chemicals and the additives that are in today's more potent weed have some addictive properties to them, in addition to maybe the genetic biological component the substance itself has more risk for addictive behaviors?
Yeah, the higher potency makes it more addictive. There's also a lot of other chemicals interacting in these
Mm-hmm.
vaped products. So we know that there's heavy metals like lead and tin, cadmium that are in some of these products. We know that carcinogens or cancer-causing agents are in these products. And then flavors and other kind of chemicals that normally aren't things that you ingest. And so again, we know that these substances can cause problems down the line. And,
Mm-hmm.
we're going to be monitoring to see what happens with youth that are using these for decades. Like, we found out with decades of cigarette use, what type of cancers and other things come from that.
So we're kind of using what we learned from the whole nicotine and cigarette experience to help us track forward what we might be looking at down the pike for marijuana experience.
Exactly.
Oy. Well, let's move into vaping a little bit. What is vaping? Why is it so popular? What do parents need to know? What do caregivers need to be looking for? Let's kind of start there. Break down for us what vaping is and what are the most common things that kids are using in their vapes.
Sure. I mean, first, I want to start with the good news is that kids don't smoke cigarettes anymore. So we've done a really good job at the public health messaging, the laws to decrease access, changing cultural norms that you don't really, I can't remember the last time someone told me they smoked a cigarette in my
Right,
clinic. And I say
right.
teens and young adults. Unfortunately, even though a lot of the vaping products were made to get people off of cigarettes, for youth, it's often the first time they're exposed to any nicotine product. Whereas
Mm-hmm.
adults, they might be going from a cigarette to a vape. And so, because it was originally unregulated, there weren't public health messaging against it. If you ask a kid if they smoke, they'll say no. And then if
Right.
we have to ask if they vape, and they'll say yes. And they don't even consider it
So
the
they
same.
don't even consider it smoking.
They don't
Gotcha.
consider it smoking. They don't consider it
Yeah.
the same thing. And so we've had to change our language. But
Mm-hmm.
vaping is the older term e-cigarettes. So it's electronic devices that, combust nicotine into a vapor. Again, there's no smell with it. Sometimes they have flavors, which are very attractive. The packaging looks like everyday objects. There were versions of it that look like USB drives. They can be small. You plug them in to charge them, and they parents may not be aware that that's what the child is using.
So are most of the kids using nicotine in their vapes or THC or a combination or something else entirely?
I think most are nicotine, but
Okay.
about 30% of the nicotine users also vape THC, which
Mm-hmm.
is the chemical that's in cannabis or weed or marijuana. And so a lot of times we see both. Some kids may not know if you're getting a vape from your friend. People aren't asking, is this nicotine? Is it THC? They're just
Right.
taking a vape. And so I've
Right.
had patients who they've come in and they had an episode, they didn't realize they thought it was a nicotine vape, and then they had a bad reaction and realized there was THC in the vape. So a lot of times
Okay.
they may not know what it's using, particularly how people begin. Parents are using their friends' vape.
Well, and we're seeing an increase in adults using vaping products also. So the modeling of what to use and where to use it, they may not be discussing it at home, but they're seeing their parents do it or their caregivers do it.
Exactly.
Yeah.
Yeah, it's very important to model, what we want our kids to use. And again, for parents, sometimes they are using that to get over, their cigarette addiction. But you have to be careful, if you're using any type of recreational marijuana or medicinal marijuana or vaping, that your kids do not have access to it
Right.
until you're able to quit yourself, which I hope you're able to quit yourself.
Right. Yeah. So why is it so appealing to tweens and teens that have never had exposure or use of any other substance? What kind of makes it intriguing to them?
So I think it's the novelty.
Mm,
Teens' brains are wired to try new things. That's why they can learn Spanish and algebra, things that I could not
right.
do right now with my not teen brain.
Yeah.
And that's why they can join the military and be in athletic competitions and do all kinds of wonderful things. They're wired to seek new experiences and try something new. And this is truly new. The exposure is also there, almost universally even down to some elementary and middle schools. You'll see use actually in school, not only in the bathroom, in the classroom, because the
Right.
teacher can turn their head and you can hit your
Mhm.
vape a couple times and be done with it. Some of my teacher friends have told me those experiences. I know principals that have alerts on their phone that tell them when, vaping is happening in the bathroom. And a
Mhm.
principal showed me where the vape alert had went off 100 times that day in the high school bathroom.
Yeah.
And
Yeah.
so I think just the exposure that people have to vapes, it's new, it's being advertised and targeted towards them. That's
Right.
why they're doing those flavors. That's one of the reasons why teens are using. And, their parents are using, they're seeing them, and their friends are using.
So it's kind of just bombarded from all sides for our kids.
Exactly. Exactly.
What are some of the immediate health concerns that we need to know about regarding vaping and young people?
So I think the one of the things I see most immediately with vaping is again the addiction. It's so much easier to get addicted to something the more you can use it, and because you don't have those barriers of smells, and that you can use it almost anywhere. You can use it
Mm-hmm.
during the school day. You can use it at home in your bedroom. I'm seeing addiction earlier ages or after earlier use because of the frequency of use and how the nicotine changes the brain. We're also seeing people come in with chronic coughs, decreased athletic performances. You're not able to run as fast
Mm-hmm.
when you've been vaping. And again, nicotine is an appetite suppressant, so it decreases your appetite. So we've seen weight loss associated with that as well.
So, long term, what are you most worried about when it comes to kids who are vaping? What should we, as parents and caregivers, be worried about the long term?
I think long term, all of the long term things that we were worried about with cigarettes and tobacco products, we have to worry about with vaping as well. The cancers, the lung disease, all of those things. There's no evidence that we're going to see less of that in the vape form versus the, cigar or cigarette forms that we're using before. And I think, again, the addiction and the problems that that has, this is more like a medium term effect. Kids are getting
Okay.
kicked out of school.
Mm.
They're getting expelled for using these products in school.
So, interrupted education, excuse me,
Exactly.
is a in high school is a huge impact. Yeah.
Yeah, a lot of schools have zero tolerance policies, and I
Right.
understand that they want the schools to be safe,
Mm-hmm.
but these products are universal, and you have a child that gets caught, and then all of a sudden they're expelled from their home school and they have to
Right.
go to another school or online school. So I
Yeah.
think those effects and those outcomes are one of the things that we have to worry about and how it affects their educational attainment. And we would love for schools to kind of have some alternative pathways that get people into treatment and education as opposed to expelling them for this behavior.
Yeah, and when you're talking about a population of kids who are already at risk for learning impacts, learning challenges, cognitive delays, or other developmental delays from trauma, prenatal exposure, et cetera, having your education interrupted, coupled with the potential long term impacts of vaping and what it does to your lungs and the rest of your body, that's a pretty big ball of wax for parents to kind of be holding space for. I'd like to talk a little bit about something that you mentioned earlier when we are concerned about the long-term effects. They should be the same as what we are, looking at for the cigarette factor. Can you be a little bit more, can you hone in just a little bit more on what some of those effects would be? I've heard a lot of families talking about some of one of my friends called it sticky lungs from vaping. And I'd love to hear a little bit more about that, kind of the real specific long term impact that might be.
Sure. A few years ago, there was kind of an outbreak of the EVALI, which is e-vaping associated lung injury. And even though we're not seeing as many cases as we saw in 2019, 2020 when that came out, we're still seeing cases of a lung injury and damage. Sometimes people are coming into the hospital needing treatment with steroids and oxygen due to lung damage, and that's when they're young. So that's one of the effects of it. We know that smoking can put you at risk for, asthma attacks and
Mm-hmm.
worsening the asthma, for chronic obstructive pulmonary disease when you get older, and a variety of different types of cancers that are increased with the carcinogens that are in cigarettes, and some of those carcinogens are in the vape products as well.
So that lung injury could follow them for a lifetime, then, is what I'm hearing you.
It can. In some
Yeah.
rare extreme cases, it's been bad enough where people needed lung transplants. Fortunately, we don't see that
Right.
often,
Right.
but it is, I have some athletes where they notice it affects their performance. And then we're in the back to school, like trials start next week season. You want to be optimized in your performance, and it can affect that as well. I also worry about, people, particularly those youth in foster care and kinship care, turning to substances to cope with problems, that they're losing the opportunity to learn alternative coping skills with life stressors that they unfortunately have more of than the rest of us.
That's a good one. Yeah, I appreciate that. So let's move right into how that impacts our community. We are a community of parents and caregivers who care very much about building alternate coping strategies for our kids, giving them healthier ways to deal with discomfort of the internal state, whether it be fear or anxiety or a trauma wound or something like that. Let's start the conversation with a few strategies that adoptive, foster, or kinship caregivers can start to implement in their homes that would help buffer our kids against turning to weed or vaping to kind of solve the internal chaos that they may be feeling.
Sure, that's a great question. Prevention is really important in pediatrics and adolescent medicine. And so, luckily, there are things that we can do to modify the risk. One, I think you have to know the risk. So, know
Mm-hmm.
the fact that, that if they've had trauma and they're in care, we know that youth in care may use substances at or more than youth that are not in care. If they have a genetic risk factor, because they have a parent that has used substances, knowing that and knowing how to talk about that, and how maybe they may not be the one that wants to try it because they might be hooked, where their other friends that don't have that family history may not get hooked at a young age. I think it's also important to have communication where you can talk about your stressors, talk about what's going on in school and your relationships as a caregiver with your teen, and having that communication is also important. And then all the other things, activities, supervision, connection to the community, to sports, to school, community service, any of those things are important, and teaching the coping skills. So having like a physical coping skill that you can do, and then also like an emotional or spiritual ones, are very important.
That's great. I think that I love it when you said prevention in pediatrics is such a key. It's true when we can catch them really young and help them develop new and different habits. I think another thing that I would add to that is when you are raising a child who has come to you from another situation, whether it's out of the foster system or international adoption, or even raising your grandchild when there's been an inability to live at home any longer. One of the things that's probably super important to remember is helping the child or the young person, tweens and teens, understand the context of where they came from. If you have information that you can, in age appropriate ways, share with them about their biological family's history of use or abuse of substances, and help them understand that those coping mechanisms were not healthy, and you're ready and willing and able to teach them new coping mechanisms, but also helping them understand, again, in an age appropriate way, what the internal tendency towards addiction or abuse might be. Certainly, we cannot determine that in any sort of percentage or, great degree of certainty, but it is something that we can talk to our kids about and help them understand that their context may be different than their peers. So in a group of 5 friends, 3 of them may have grown up in a very typical family, And two of them may have had, impacts from the foster system or impacts from, connection to adoption. And so their context will be different than their peers, and helping them understand that in kind of those very straightforward conversations is a big buffer. I think if we can try and remember to do it without instilling fear, that's, one of the challenges that adoptive and foster families face, is how to share this information about the child's true story, full story, without instilling fear.
Exactly. And I think, your talk about context is really important. Their perception might be that this is normalized and everybody is doing it.
Right.
We know that the vast majority of middle and high schools are not using substances.
Right.
And the study last year, 6% of kids were using e-cigarettes, and 8%. We haven't talked about the nicotine pouches. That's another form.
We'd love to talk about that too.
Yeah, we'll talk about that. So, 1.8% were using the nicotine pouches. That means there's a vast majority of kids that are not using these substances. So like normalizing the fact that no use is actually what most teens are doing, and that these substances are being targeted so that people can make money off of their misfortune of trying these substances and addiction. Some of those things can be helpful in talking to youth.
If you liked what you are learning with us today so far, please go to the platform where you listen to all your favorite pods and leave us a rating or a review, or both. We are on the biggies like Apple, Spotify, and YouTube, but we're also on many other podcast platforms. And when you leave a rating or a review, or both, you help us get this information into many other families' hands, and we would appreciate that so much. How early should we start these conversations?
I know that's a good question. It's interesting. They recommend asking what we in medicine we call screening for alcohol use as early as 9. We really want to start asking about it and having the conversations before they're first exposed. I would say probably most practices it's around that 11, 12 visit that your provider will start talking to you alone and asking if you've had use. And then if you're not having use, doing a little bit of education about that. If you've had some early exposure, maybe you had a drink at a party, we'll talk about that in the visit. So I definitely, anywhere in the older child, middle school age is a good time to start having those conversations. It should be ongoing conversations. I like to have conversations, with my kids. When you see something on TV or social media, it's a good time to talk about, oh man, what happened. I don't know if you see the Eagles in the back. We went to the Eagles parade.
Go Birds.
And yeah, go Birds, right? And then you can, we were at the parade and there was a lot of marijuana in the air. So it was a teachable moment to talk about the first parade, the first one.
Yeah.
A teachable moment to talk about, marijuana use. And so taking those teachable moments and having it to be just part of your routine conversation, as opposed to let me sit down and have a talk with you, is a way to address it.
Yeah. And I would put a plug in that the first time your child talks about it with an adult should not be in the pediatrician office the very first time. Try and get to it before the pediatricians start talking to your kids about it. Your goal as a parent and a caregiver is to build that trusting, safe, secure relationship with any child in your home. And so talking about these hard topics goes to building that trusting, lasting relationship. So get the conversations started. Again, use media like Dr. White recommended. Use books that they may be reading for school. Use songs you hear when you're, driving around together. Just start the conversation. It is awkward. It's uncomfortable. I have 6 children. I've had to do this multiple times, have these awkward, uncomfortable conversations, but it's worth it if you then have a kid that comes to you and says, hey, I was at a party and so was using pot and I'm not sure what to do about it. It gives you that opportunity to talk to your kids and have really honest conversations. I will be the first to admit, my kids were kind of laughing at me when I told them that I was doing this interview. I'll be the first to admit that I did not, coming into today's conversation, know nearly enough about weed and vaping, and hopefully we'll get a chance to talk about the nicotine pouches. I've just not had enough exposure or experience with those conversations. And I'm recognizing now, as I'm learning more about it, that that's kind of a gap in my parenting, that I can't go back and fix it now, but I still have two living at home that I can talk about it with. So for some of our kids who have these higher vulnerabilities, like we talked about at the top of the show, what are some additional protective factors or environmental things that we can put in place that will maybe help reduce their risk?
So I think, it's important to know that when you're more vulnerable, to have that early identification and intervention. And so if you were to notice a vape, we don't want people to overreact and,
Right.
punish them and do a lot of yell and screaming, but taking the opportunity to have that conversation. Hey, I noticed this in your bag, or the teacher called me. This is really concerning. Can we talk about this? Do you feel like you're addicted? The kids will tell you. People come into my clinic and they will tell me, you know what, last year I was doing it a couple of times. Now the last month I have to do it every single day, or I get a headache, or I get anxious. And so having those conversations so you can get a sense of where they are on the spectrum is important, but also putting those positive things, positive activities, positive ways of coping and getting those new experiences is going to be important. And I think we have the awkward conversations. Let them teach you. Like, they love to teach us. You haven't heard about that? Let me tell you. And they'll pull
Yeah,
up
yeah.
something. And so, like, let them teach you what products they're using, what brands are out there. It changes all the time. And just
Mhm.
know you're going to get some eye rolls, but the eyes are rolling. That means they heard you. A lot of parents think that they're not listening.
Right.
They are listening to us. They do hear what we say. And that's what makes the eyes roll. It's the fact that they're listening.
Um, Expressing curiosity is one of those buffers that we can put in place with our kids, not just curiosity about issues around weed and vaping, but general curiosity about their life and what they're interested in, why they're interested in it, what draws them to it, kind of engaging in that I wonder or that observation language. If you develop that habit when they're very, very young, then it's easier for them to feel as if you're a safe place to be able to talk about it later. And talking about things later often means, like a friend of mine said the other day, the bigger the kid, the bigger the problem. Bigger the kid, the bigger the issue. And not that the kid is the problem, but the issues that they're facing are more complex and tangled. And so setting that stage of curiosity and wonder and observation earlier and younger with kids who have these increased risk factors or increased vulnerabilities is a great shift on our part. So I want to move into, I'd like to go ahead and talk now about the nicotine pouches. We didn't have it on our original agenda to talk about, but it certainly fits well into this topic. So if you want to just share a little bit about what they are, again, what's appealing about them to young people, and what are some of the risks that we need to be aware of?
So these are newer products that are out there where it's nicotine and, like, again, flavors, because that's the theme, flavored
Mm-hmm.
pouches.
Mm-hmm.
And, this has the advantage of you don't have to smoke or vape it. So it's like, think about chewable tobacco, and this is kind of a newer version of that. Again, it's being marketed as a smoking cessation product for adults, but for kids, their flavors, their availability in, local convenience stores makes it an entryway into nicotine. And there's different brands that come in different pouches that you can just kind of put in your cheek
Right.
and kind of suck and absorb, get nicotine that way. And so again, it's just another product to keep up with, that we have to educate folks, that we have to ask about. So now, I used to ask, do you smoke or you drink? And now it's like, in the past year, have you tried any tobacco product? That could be a cigarette, a vape, a pouch. The list is
Okay.
longer and
Okay.
longer of different things that we have to balance. Hookah, like all the different,
Right.
there's so
Right.
many different forms of
It is a
tobacco
lot to keep
now.
up with as a
It is
parent
a
or
lot to keep
caregiver.
up with as a parent and as a doctor.
Yeah,
It
I'm
is a lot to
sure.
keep
I'm
up.
sure.
And I learn, from my patients every day of different versions. And again, they love to be the expert to tell me if it's something I did know.
Yeah. Regarding the pouches, is there an age limit? Are they supposed to be checking age ID when they're sold in stores?
They're supposed to be, but we know that kids can get access in a variety of different ways. And then people can also buy things online,
Okay.
which is another way that substances are getting into our homes without having to go to the typical store with a fake ID.
Right. So a lot of kids are using them not for smoking cessation. What are the benefits that the kids feel when they're using a product like a vape? Like, what are the physical kind of the dopamine hits that they're getting from doing this?
Yeah, they feel a buzz.
Okay.
They feel decrease in anxiety, a lot of folks. And then once your body becomes dependent on the chemicals, if you don't take them, you feel anxious. You can't sleep. So
Okay.
you need them to
Right.
be able to sleep or to be able to not feel anxious. But a lot of times it's just the initial buzz and high
Okay.
feeling.
And that's true of marijuana, of vaping, and of the pouches,
Correct.
because they all have similar substances within
Mhm.
them.
Yeah, that affect those brain chemicals and give you those big endorphin boosts.
I'm sorry to interrupt you one more time, but I wanted to let you know that you can keep up with all of the fresh new content that Creating a Family adds to our website every week when you get our free newsletter right into your inbox. Every month, you would get a free newsletter, and if you subscribe today, you can get a free downloadable guide that will support you and strengthen your family. Once you go to creatingafamily.org/newsletter, you can pick one of the free downloadable guides that applies to your family and will strengthen you and improve your parenting skills. We love giving parents more tools for their parenting toolbox. So check it out today. You can choose adoption, foster, kinship care, or professionals, depending on which community serves your needs the best. Thanks so much, and let's go back to the show. What are some of the signs that parents and caregivers can be alert to? We talked about them a little bit at the top of the show, but in general, for weed, vaping, pouches, any of those things, what are some of the signs that we should be kind of ticking off in our brain to help us know whether or not a child is engaging or trying to hide it or whatever?
Sure, I'll start with the more serious ones first. This is a good time, as you're going on those family vacations, right? And you're going to be somewhere for a week and you notice your kid's a little bit more irritable, they're anxious,
Mm,
they're sleeping, they're going out, away from the rest of the family. That can be a sign that they're addicted to a substance and that they're in withdrawal. And they may not even know that they're in withdrawal until they are away from it from a particular time. Obviously, if the school is calling you about use at school, that's another sign that they may have developed a serious problem. And then, if you're seeing puffs of air, little puffs of smoke in the house or smelling strange flavor smells, again, it's not as strong and pungent as cigarettes and cigars and those things were, but they do have some smells associated with as
okay.
well. And then they may, again, if they're not using in front of you, maybe leaving, going to the bathroom, going outside to use. And those could be signs. But it's one of the things to think about with weight loss. There's so many different things that can cause weight loss, eating disorders, but we're seeing a lot of patients where it's the substance use is causing the weight loss because they just don't have an
Right.
appetite. They don't feel like eating when they're taking high doses of THC or nicotine.
So some of the more immediate symptoms that we might be seeing would include that anxiety or irritability.
Hmm.
Are there any physical symptoms besides the puffs of smoke? Are there physical symptoms that we might see kind of in the short term or the immediate?
Maybe increasing cough could be some of the things. And then you might see where their endurance is not the same with sports. They're more winded
Mm-hmm.
for THC or the cannabis related. It may make them more anxious to use. You may have more stomach aches, vomiting. Those could be some of the signs that you see with that use.
Okay, great. That's kind of a review of what we've already discussed then.
And then
Appreciate that.
changing your grades as well. So like if all of a
Oh,
sudden your grades
yes.
are not, doing well in school, than
Yeah, so changes
yeah,
in school
behavior.
performance or engagement, but also some sleep changes would
Yes.
probably be included in that.
Hmm.
Okay, so when a parent or caregiver suspects or confirms use or abuse, how do we hold the line with our kids that comes across as supportive? I want to come alongside of you. I want to help you conquer this. I want to help you kind of kick this, but firm in a way that says, this is not what our family stands for. This is not who we are, kind of a thing.
Yeah, I think you want to give that clear message of your family expectations and that abstinence is normative for kids. It's what the majority of kids are doing, and that's what you want for them. I think that should be clear. I think that can be a challenging situation if the parents themselves are using substances because they're seeing you. And I've had patients
Yep.
say as soon as their parent leaves the room, well, they didn't tell you my dad smokes weed and my mom smokes cigarettes. So why did they bring me in to see you? Because I'm doing the
Right.
same thing. So you definitely have to think about your own use as well and be a model and treat that so that you can be a model for your kids.
So consistency of action and message, integrity, holding the line in a supportive way that, kind of says it's you and me against this substance, not you versus me.
Exactly. And you don't want to be too punitive. You don't want to, make it so that people are scared to tell you. I know some
Right.
parents will run and get home drug testing and put them on a
Mm,
drug testing. That's not something we really recommend that parents do. If there's concerns, going to a professional so they can get assessed, and you can start with your primary care provider as a first person to reach out to is one of the first steps. And then you also want to remember that they're still your lovable kid that they were before you knew about their use,
right.
and that you recognize that, and that that doesn't mean that you don't love them, that because you're
Right.
disappointed in a behavior that they've done.
Yeah.
Yeah, it's pretty important for kids in care, right?
Yeah.
They've
Yep.
already had lost connections with their
Right.
family. That this
Yep.
doesn't mean that you're going to put them out the house, call the agency, but you do want to make sure they get help and you have rules that you can't do this in this house.
Right. I saw something the other day that said bad decisions does not equal bad kids.
Yes.
And it's so important that we help our kids recognize when you make a mistake, when you fail, when you don't hit the mark of what we as a family hold true, you got to give them a path back. And when we remain open, when we remain accessible in that way, it's giving them that path back. It's giving them that second chance and being humble about it and acknowledging all the ways that you've also missed the mark and not held the family values, to
Yeah.
priority. That humility, I think, makes you more accessible as a parent. That's a hard one for me, I will admit, because I don't really love airing my mistakes because I'm usually
Right.
beating myself up about them.
Yeah. And
It's a
and
common thing.
it is important to think about how you might have contributed, to their substance use even inadvertently. Like
Mm-hmm.
maybe they were super stressed out about that SAT that you put them in class and you're super
Right.
focused on.
Right.
And so acknowledging that, oh, I understand this is a hard time for you
Yeah.
and you might have went to that.
Yeah.
How can I take some of the load off? Maybe we don't have to take 5 AP classes
Right.
this
Right.
year, or they have to get a job and work in school. Maybe there's some ways that we can make it so that you have time to hang out with your friends and go do some fun activities and don't feel like the only break you get in life is when you're able to smoke or vape.
And that brings up a really good point for families that are welcoming new foster children or, an aunt or an uncle that's welcoming a new relative child into your home. Many times those children will come with, I say children, young adults,
Mhm.
youth will come with these habits already forming. And you weren't there to set a good context, set, preventative buffer strategies in place, but you still got to deal with what's in front of you. And the child that's in front of you, number one, is still a child, even though they're, 15, they're still a child. It's still a child's brain that's still developing in there. And tiptoeing into that gently and lovingly, making yourself warm and welcome to start and not trying to tackle all the bad habits first, right off the gate, right out the gate, establishing that trust and establishing that relationship first, giving firm boundaries that say, I know you came to this house with this habit already entrenched, and if you feel the need to do it, you'll have to do it outside. When you're here in the house, please don't do it. There's other children, there's other people that don't want to be impacted by it. And if you are open to it, I would love to help you find other healthy ways to cope. And just kind of setting that slow roll towards healthier expectations instead of jumping on it all at once.
Yeah, you did a perfect description of what we call harm reduction,
Right.
which is if we're not
Right.
going to quit right now, can we decrease the use? Can we use in a more appropriate way?
Right.
And in a safer way, so that we're not exposing other people in the house until you get to the point where you're able to completely quit. And I think what you describe is a perfect way of messaging with youth that already have, exposure. And there's help out there. There are even programs online that you can sign up for Text to Quit. Well, they will text and give support. There are quit lines. Most of the quit lines, you have to be 18 to call the quit line. But there are quit line now. There are quit lines that are available as well for those youth that are 18. There's medications that are also available to help with nicotine withdrawal. The same ones that are available for adults are available for teens as well with prescription.
And that's another thing that's so important and could be included in one of those buffering techniques that you offer your kids, is letting them know, I'm not just available here to help you. There's a whole community of professionals that are willing to come alongside of us and help us help you through this and to overcome it and to find healthier coping strategies. Because everybody needs coping strategies.
Absolutely.
We all need them, but we want our kids to have the best opportunities and the best resources available for healthy coping strategies. So that's great. Sometimes experimentation can cross a line rather quickly for kids that have increased vulnerabilities or increased risk factors. What do we need to know about what that line is, and where do we go when it's time to, because they've crossed that line and we need to get them some help?
Yeah, when you start having consequences, I think that's when you've crossed the line. Again, grades changing, getting in trouble at school, getting admitted to the hospital for medical complications of your use. All those are red flags that we've crossed the line and we need to, seek help. And are there any other substances the patient is using or your child is using in addition to that? A lot of youth may start with, a nicotine and cannabis and alcohol. But there are other substances that people are using as well. So making sure they have a full assessment of what's going on. We also know that people that use those substances, maybe they're not using them yet, but they're going to be the kids that are more likely to try some of those other substances like opiates and fentanyl and benzos later, methamphetamine, things like that. So getting that early identification and getting help, and there's professional help available in a variety of different ways early is really the key.
So are there any specific types of programs or support resources out there that are better suited for kids who come from a trauma background?
So there is trauma-informed, trauma-sensitive care that's available. And when you're evaluating drug and alcohol programs, that's one of the things you can ask is, do they have experience with that trauma-sensitive care? And I think it's also really important to have that if they can have a relationship with the provider that they were maybe seeing before they came to your house, going to that provider, someone that they have a relationship with, so they feel comfortable talking to and coming up with a specific treatment plan for them that can be helpful.
Yeah, if you're a foster parent or adoptive or pre-adoptive parent who's already, put into place therapeutic supports, regular counseling or therapy, having that person follow your child through the process of any of these healing adventures. Yeah, it's very helpful to have that consistency of voice and consistency of care so that the kids know, I'm in your corner, I've got your back. I think it also helps to have the kids hear and see you as the parent or caregiver advocating for them to those professionals. It's okay for the kids to hear and see you saying, no, I actually think my child needs more, or my child needs something different. This doesn't feel like it's really hitting the mark. Letting the kids hear that, can be another buffer, another strategy that helps them feel seen and heard, and that someone is on their team long term.
Exactly.
What would you say to a caregiver who is feeling overwhelmed or ashamed that this has now become part of their child's story? How do you kind of help the caregivers that you work with kind of get over that hump?
I think one, know that, this happens and this used to be addiction and substance use was like a moral failing, right? You didn't have the
Mm-hmm.
willpower to stay away and your parent didn't, raise you up right. And that's why
Mm-hmm.
you expose. We now know that this really has a lot of genetic and neurochemical basis for this.
Mm-hmm.
And
Mm-hmm.
so, and again, people aren't using substances with the thought that it's going to change my brain chemistry. I'm going to have to use this for the rest of my life.
Right.
You're using this
Right.
substance to feel better, to get high, to relax. And then there's this kind of slippery slope where some people will develop a problem. And not everybody knows that they're predisposed to developing a problem. So I think, there's a lot of stigma with addiction. I think we've gotten a little bit better with mental health and decreasing that stigma. We still have some work to go with the stigma with kids and adults with substance use disorders. But making sure that you talk to your fellow, co-parents. Like a lot of people are struggling with this. Anytime I give a talk or, I'm in a space and talk about what I do, I'm on the train or something, then people disclose to me the family member they had that had a substance problem. This is universal. It's an American problem that's shared by everyone. And so nothing to be ashamed for, but you definitely want to seek help for these youth.
Yeah, this issue of shame and stigma is a huge one when you're bringing in a relative's child. Say
Mm,
it's your grandchild and you're feeling embarrassed and ashamed of the failings of your child to be able to parent their child, and just kind of offering grace to everyone involved. None of you planned for this, none of you wanted this, but this is where you are. And so, how can we move forward with getting everyone the help and the healthy resources that they deserve and that they need, and keeping the child that you're caring for at the center of your conversations can help kind of push aside some of that shame to push you through to getting to the right resources and support that that child may need. It's a sticky wicket for many kinship caregiving families. So I appreciate you clarifying it that way for us. If you could just offer, as we're kind of wrapping up here, give me just like one piece of advice that you would offer to parents or caregivers who are trying to educate themselves and navigate through this, as you said, universal cultural phenomenon that we're facing as a nation.
I think if there's one piece of advice, well, one, I want to thank you. I used to run a foster care clinic, and in my previous job, I worked with a lot of foster care families, particularly those of you who foster older children and teens. I know
Yep.
that is a tough job, and
Yes, it is.
we really appreciate what you do. So one, I want to thank all of you guys
Oh,
that are listening today, and thanks those of you who foster and do kinship care for our adolescents and youth. If there's one thing, I think you've already done it, right? You're providing a safe, nurturing home and having open communication. I think also going, part of the process is they're going to be seen by healthcare providers. Finding someone that you really trust that's really
yeah.
good with talking with youth. Adolescent medicine is a great specialty. There are also a lot of practices that have experts in pediatricians that deal with kids in care. Having that connection and having the alone time with the provider so that they're able to express their concerns, and not just their concerns, but what they want to be in life and what they're good at and what their friends think about them. All of that is really important for teens as they develop into young people.
Well, I think that's a great way to wrap this up. Dr. White, thank you so much for your time today. Thank you for bringing the wealth of life experience as well as your medical and educational experience to the table today to help us understand more about weed and vaping. And we threw in nicotine pouches, not even planning to, but I appreciate the willingness to go there. Thank you so much for all that you do to serve the Philadelphia community of adolescents, my family's patients at the CHOP practices, and we've enjoyed the benefits of such a well-founded organization. But I know that families who are looking for more information, they can start with their local children's hospital, correct?
Yes, they can.
and adolescent medicine programs at your local children's hospital can be a great place for you to start if you're looking for more information on how to handle weed, vaping, and all the other substances out there that kids can get into. Thanks so much for joining us today. If you liked what you heard, please drop us a rating or a review, and we look forward to talking to you next week. Thank you.
Thank you so much.